Germ cell tumors. What is choriocarcinoma? Imagine a cancer that grows rapidly and can spread through the bloodstream to other parts of the body. That's what makes choriocarcinoma a particularly aggressive type of germ cell tumor. It originates from trophoblastic cells, which are the cells that normally develop into the placenta during pregnancy. When these cells become cancerous, they form a tumor that can grow quickly and metastasize, or spread, to organs like the lungs, liver, or brain. Choriocarcinoma is most often associated with pregnancy-related events. It can develop after a molar pregnancy, which is an abnormal growth of placental tissue that happens when the fertilized egg doesn't develop into a normal fetus. It can also occur after normal pregnancies, miscarriages, abortions, or ectopic pregnancies. In men, especially in cases of testicular cancer, choriocarcinoma can arise from germ cells in the testicles that differentiate abnormally into trophoblastic-like cells. These cells produce high levels of a hormone called human chorionic gonadotropin, or HCG, which is normally made during pregnancy. Symptoms of choriocarcinoma depend on where the tumor is located. In women, abnormal vaginal bleeding after pregnancy is common. If the cancer has spread, symptoms might include pain or pressure in affected areas, or signs related to metastasis like cough or shortness of breath if the lungs are involved. Elevated levels of HCG in blood or urine tests are a key marker for diagnosis, as they reflected the tumor's origin from placental tissue. Diagnosing choriocarcinoma involves a combination of pelvic exams, imaging tests like ultrasound, CT scans, or MRI, and blood tests for HCG. Early detection is vital because this cancer is highly aggressive but also very sensitive to chemotherapy. Treatment usually involves chemotherapy regimens that are tailored to the patient's risk level. Many patients respond well and achieve remission or even cure when treatment begins early. Sometimes surgery is needed to remove the tumor or affected tissue. From a broader perspective, choriocarcinoma links closely to reproductive health and germ cell tumors. It highlights how cells that normally support pregnancy can turn malignant. In testicular cancer, choriocarcinoma is a rare but serious subtype that requires specialized treatment. Understanding its origins, symptoms, and treatment options helps healthcare providers manage this aggressive disease effectively. In summary, choriocarcinoma is a fast-growing malignant tumor of trophoblastic cells that often arises after pregnancy but can also develop in testicular germ cells. It is characterized by high levels of HCG and the ability to spread rapidly through the bloodstream. Common causes include molar pregnancies, normal pregnancies, miscarriages, and ectopic pregnancies. Symptoms include abnormal bleeding and signs of metastasis. Diagnosis involves clinical evaluation, imaging, and HCG testing. Treatment primarily involves chemotherapy, with many patients achieving remission if diagnosed early. Recognizing this cancer's link to reproductive health makes it a critical focus in understanding germ cell tumors and reproductive cancers overall. Always consult healthcare professionals for personalized advice and treatment options.